Okay, hello everybody. I am here with Georgie Coghlan, and my name is Reine DuBois, and we are doing this podcast on fibromyalgia, all things fibromyalgia. And I'm super excited to be doing this podcast with Georgie because she's done a lot of work. She's had her own personal experience of fibromyalgia and recovered from it, and I'm really hoping we can give everybody some clarity and some hope around this condition. Very, very debilitating for most who are experiencing it. First of all, I'd like to say that fibromyalgia is a syndrome and not a disease. And for that reason, so a disease is a very established condition, a condition where we know most of the parameters involved in the condition. Whereas syndromes, like chronic fatigue syndrome and fibromyalgia syndrome, are a group of symptoms, and the symptoms can change depending on the presentation and depending on the drivers. So it's a lot more complex in its treatment. Its approach needs a complex way of thinking and quite often needs a team. But Georgie and I have worked together, and Georgie's cracked the code. I would like to say fibromyalgia is very treatable, and I have had many successful cases of it over the years, but using the integrative model. And so that's what we're going to explore with you today as well. So Georgie is a holistic fibromyalgia coach, and has broken it down into 3 categories with which we need to really address fibromyalgia. Can you start by explaining those 3 categories?
Sure. So the first one is working with medical professionals to diagnose and treat any underlying pathologies or disorders, or any drivers of chronic pain that may be due to past injury or surgery or things like that. So we really want to get in there and make sure the biology is all functioning optimally. The second stage is good quality psychotherapies and neuromodulation to rewire the nervous system out of any chronic stress or trauma so that the body can relax and work properly. And the third stage is lifestyle changes. So for me, that was optimizing sleep, nutrition, and joy, as well as stress management, and reducing any burden of toxicity or inflammation or stress. Yeah.
And infection was a big part in your story.
Yes, infection was probably the key underlying driver for my health, yeah.
So Georgie, you had done a lot of work and a lot of research before you came and started working with me.
Yeah.
And it's not uncommon for patients to come well versed in their condition already by the time that they seek integrative healthcare support. So you had a lot of pieces of the puzzle. You already knew that the psychotherapy and the neuromodulation was essential, and it's a big piece of the puzzle that's missed. And I usually spend a lot of time with patients convincing them that this step is important.
Yeah.
Like, how can my stress and trauma be related to my fibromyalgia?
Yeah.
Can you tell us a little bit about just your journey before you started working in, and us working more intensely on the diagnosis and the treatment outline?
Sure. Well, I got diagnosed 20 years ago in my early 20s, and for about a decade I just went to standard GPs and wasn't really given any practical solutions or options. I didn't respond well to the medication options, and so I tried to just deal with it. But I had recurring nervous breakdowns, and so eventually I had to leave my career and realised I had to put a lot more attention to my health. I became disillusioned with the medical industry for a couple of years and went more down the psychotherapy, emotional healing route, and that was really valuable. It was a vital step of my healing. But I made really good progress with that, and I was still affected by a lot of my fibromyalgia symptoms. I was less stressed, my nervous system was regulated, but I was still having the symptoms. And in fact, they were getting worse. When I came to see you, in some ways, I was at my worst. And that's because we hadn't actually gotten to a number of the underlying biological issues.
Drivers.
Yeah.
So we did go on and do quite a bit of private testing, and these are expensive, these tests, and so quite often patients aren't working, they can't work, and they're investing in their health and they're investing in practitioners. But the tests were invaluable.
Yeah.
And so I just want to go through quickly for the listener at home, the testing that we did and the aha moments we had or didn't have from the testing. And sometimes when you get, you spend $360 on a test and it comes back and it looks beautiful, that can be disappointing. But for me, it's always a celebration of what we don't need to address.
Yes. And also I learned how to use that as positive reinforcement, that there's still a lot right with me, despite the fact that there was obviously things that were wrong, and some days it felt like everything was wrong. Every test that came back normal, I was like, great. Yeah. My body's doing that right.
Yeah. Yeah. And I mean, if we were to start with the OAT test, the organic acids urinary test, there was a big aha moment in and around that. The tryptophan metabolism was right out, and instead of making 5-hydroxytryptophan, which converts into serotonin and melatonin to help with that sleep-wake cycle, there was quite a big candida overgrowth that was driving oxidative stress in the body. So super, super important pointer right there. We used bioresonance as well because we knew that there was a viral load in the system. And the bioresonance confirmed there was a viral load and a heavy metal load. So we went on to do some hair mineral analysis, your favourite test at the moment.
Yes.
Do you want to tell us why it's your favourite test at the moment?
It's my favourite test because on the weekend I did a full-day seminar with Interclinical Labs where they told us in detail about the benefits and just what can be extracted from this test. It's really remarkable.
So much information. Yeah. But the big aha was super, super low potassium, which means we've got this very depleted adrenal state. We've lost that beautiful mineral that helps with blood pressure maintenance, so that sort of vascular integrity and that collapse state was really important. But potassium is also super important for the acid-alkaline balance. So we'd lost that cellular signaling, cellular health, and there was some heavy metals in there, but the body wasn't excreting them well. So we knew we needed to do some work around that. We knew we needed to do some work around the candida. So we went on and we did a GI mapping. That was quite pivotal for you as well.
That was probably the hair mineral analysis and the GI map were probably the two most valuable tests that helped me in the final stages of getting better. The GI map showed that I wasn't digesting fat properly.
Big find.
And I already knew I didn't make good, clean energy from glucose. So my body was needing that fat as the alternative energy source. Because I wasn't digesting that, I was chronically fatigued. There was also low secretory IgA. Do you want to talk a little bit about that, Reine?
So that's that beautiful mucosal lining that lines the whole digestive system and helps with absorption, but helps for that immune defense around the body. And because of your history of H. pylori and the SIBO picture that had ensued, we really needed to do some repair work there. We also found the candida. So again, we knew we needed to get the fat metabolism happening and just move that candida on just a little bit more, that it really was messing with the tryptophan metabolism as well.
I also showed low levels of bifidobacterium and lactobacillus species, which are key microbes for so many.
GABA production, B12, iron absorption, tryptophan production. So big mood ones, but also for pain. Pain metabolism. We did a Dutch and got a gold star there. So the hormones were somehow in amongst all of this staying beautifully balanced. So it was great that we did that test and we ruled the hormones out. They can often be involved in fibromyalgia. We did some DNA testing.
Yes.
Found some key areas there. Do you want to talk into those?
Yes. So probably the most important one was I have very low activity with an enzyme called COMT. And that enzyme is responsible for metabolizing our stress chemicals. Cortisol, norepinephrine.
Beautiful.
And that made so much sense to me because I had an extreme stress sensitivity. When I get stressed, I stay stressed far longer than anybody that I know, and it was creating real problems for me. So unfortunately, I can't go in there and switch the gene on, but I can make more wise lifestyle choices, nutritional choices, just to optimize that. And I just know that I have to be very careful about getting stressed and letting those chemicals flood my nervous system.
So we also found that you're a slow vitamin D metabolizer, and Compton D are friends.
Yes.
And PEMT was also slow, and that one is a lot around the fat metabolism and choline and all those beautiful nutrients we need to heal and repair the nervous system. We did a cytokine test because your standard inflammatory markers that we do through Medicare, CRP and ESR were not revealing anything of interest.
They're often those markers are often normal in fibromyalgia. So we're told that there's no inflammation, but there are these other inflammatory markers.
I think there's about 1,000 inflammatory markers now. So the fact that we just test 2 and then sign off on inflammation. So we did a cytokine panel, which actually didn't look too bad. But I would say, Georgie, it didn't look too bad because of all the work you had done leading up to us working together. But the interleukin-8 was slightly raised, which we will often see in patients with inflammation and pain. And it's a common one to see raised in fibromyalgia patients, just talking about the overall syndrome of inflammation. And cytokines staying raised, it takes a lot of energy for the body to keep signaling that inflammatory pathway. So you don't want your cytokines raised, you want them balanced. And then you did quite a bit of dietary stuff.
Diet's been a really big influence for me. I know it's not necessarily for everyone, but for me, it seems that the gut was the driver of my symptoms, and so I established that I have quite a sensitive nightshade allergy. So nightshades are the family of plants that includes potatoes, tomatoes, capsicum, eggplants, all those delicious vegetables that I don't eat anymore, but it's worth it. I also have been strictly gluten-free for the last 12 months. I'd sort of gone on and off it for many years, but when I started working with Reine and I just got so serious about getting on top of this, I just went, the gluten's got to go.
Just a little side comment. We don't have good quality gluten here in Australia. Still, some of our farming practices, Australia and Americas, we have the worst farming practices with gluten. We still wash gluten with glycophosphates here in Australia. So the most gluten that lands on the table is incredibly toxic. And inflammatory. All gluten and dairy. If you have an inflammatory condition, it's a simple place to start to just reduce that inflammatory load.
And also if you've got any gut, gut issues, there's a reasonable chance that you've got gut permeability, and gluten is one of those molecules that you don't want getting into your blood undigested. It's going to create problems.
So you're also grain-free and legume-free.
So there's a dietary protocol called the autoimmune paleo diet, which in its strictest form is more restrictive than what I've had to do, but that also includes eliminating dairy, grains, legumes for a period of time. And so when I really applied myself to this diet strictly, and for a number of months, it's, continued on from them, I really felt my immune system and that inflammation settle down. And so I was saying to Reine, I'm about to embark on the process of starting to introduce some of these foods very carefully so that I can increase my tolerance without, flaring up symptoms.
And I would like to say that restrictive diets shouldn't be done long term. If you're going to restrict a diet, you're probably going to miss out on some of the nutrients that we do need. And so you need to do it carefully. You need to do it considered. You may need nutrients or supplements to support with anything that you've pulled out of the diet. And they should always be done under the care of somebody or working in with a clinical nutritionist or a naturopath.
Yeah. And to that, one of the things that I do with people in my coaching is we track. We think that we can notice things in our head, but actually having a formal process where you track what you're doing with an elimination diet and the results that you're getting over time can reveal patterns that you wouldn't notice if you were just trying to do it from memory.
Yeah, beautiful. So, Georgie, tell us a little bit about Befriending the Body.
Yes. So Befriending the Body is the name of my business because really the first step in my healing was undergoing that process of befriending my body. Living with fibromyalgia symptoms for so many years, I felt like I was at war with my body, and there was a lot of resentment and there was a lot of dissociation. And that wasn't a conducive state to embark on healing. So the first thing I did is sort of befriended my body. And so that's what I'm aiming to help everybody do that comes and works with me. So I'm a qualified life coach and a certified fibromyalgia advisor. So I work to both facilitate people's personal health goals. So it's about you determining what's best for you in your health journey and what you want to work on. And then I can come in and help you to provide processes and give you information to support you with that. And I don't work in isolation. As Reine mentioned at the beginning, complex disorders such as fibromyalgia really require an integrative team. And I like to call it the team of healing allies. Nice. And you'd probably want to have a good, willing and cooperative medical doctor on there, any specialists that might be relevant. I think naturopaths have an extremely valuable place in the team. And then your mental health support and all of the team that would be specific to you and each individual.
Beautiful. So if you think that you could benefit from support and you have fibromyalgia, or somebody that does have fibromyalgia, you can go to Georgie's website called Befriending the Body, and you'll find her there. She's also on Insta and Facebook. And she's a holistic fibromyalgia coach. Or you can come to the Health Lodge Facebook page or website, and you can even just book in a little 15-minute free consult with myself, and I can kind of guide you to who's the best team for you, and would probably guide you to Georgie as well. So thank you very much. Thanks, Georgie. Thanks for sharing your story.
Thank you for helping me get better.
Yeah, it's my pleasure.
Yeah.